Yeah. Well, that's interesting because that was actually when I was telling you at the beginning when I was starting to work with Chris and Thibault and they work in DRC, that was exactly what we are trying to understand. Like they started working on the West African Ebola outbreak from London and I think also they were the kind of, their interest and personality, they were very aware of their limitation because they didn't know even, the sort of data collection, political environment and everything. So they felt they needed to go there. And so they were actually alongside field epidemiologists they were there as this sort of data field person. And
yeah, I think when I was a PhD student and I was studying like salmonella in Mexico and they're just like, oh, you should go to Mexico. I'm just like, what? I just sit in front of a computer. What do you mean? And I think that's one of the biggest things that like view that I have shifted during and after my PhD.
Yeah. Okay. Well, and I think it's going to lead anthropologists and modelers to work a bit more what they would have had a few years ago, maybe.
Yeah, definitely. Like, I think I learned first about like medical anthropologist or public health anthropologist, like when I'm in 2013 and 2014, and honestly, the first reaction was just like, what?
Yeah.
Like, this is really like a mixed method field, but then it's just like, wow, it all makes sense.
Can I just ask you last question? At the beginning, you mentioned the fact that you were engaging with stakeholder as sort of public health decision makers. And not doing community engagement. So in an ideal world where you would have the capacity to engage with communities, how would you envision that in the scope of what you're doing?
That is a really great question. I can tell you a little bit about what we were planning to do in the Vaccine Preventable Disease Project. Mm-hmm. So, because in my nature, I think researchers are self-selected, a little bit awkward people. So I think like a lot of the ways that I think about community engagement is a little bit more indirect. So at the time I was working with a tech company in China called Xiaodoumiao. So what they do is their app helps keeping track of children's immunization schedule. Mm-hmm. So from when you're born, you're going to get like a brochure from the hospital. Essentially, whenever you get an immunization, you just get a stamp on there. It's also in the system, but the system is only accessible through the government. Mm-hmm. So essentially what this company does is you can scan a code and they get authorization for like some limited use of the data. Mm-hmm. So they can help you like, it's time for like the second dose of whatever vaccine that you are due. Mm-hmm. It also offers services of booking immunizations, appointments. So we are working, I think 3 of the 4 vaccines that we're working are very targeted towards children. Mm-hmm. So for example, the pneumococcal vaccine, I think a lot of times children are not vaccinating their parents. Parents are not vaccinating their children because they're not really aware of it. Mm-hmm. So at the time we're thinking about like using this app as a platform to reach out to parents of young children for more like education and awareness. Like for example, like HIV vaccine is really beneficial and it's rather cheap. Yeah. So like a lot of times people are not really aware of this information. So I think at the time we were thinking about this as a platform. This communication was going forward until January this year, where like COVID just ruins everything. Mm-hmm. But I'm fully aware that this approach is a little bit one way. Mm-hmm. So it's just like, here's the information, read it. Mm-hmm. So I think we were also thinking about having some interactive modules at the end of this thing where people can respond to you, but what my colleague are doing that I'm not is actual community engagement at point of vaccination, because in China, like, there are special immunization clinics. So really having a table, standing there, having a banner, and I'm just like, I would be I need to mentally prepare for 3 days if I need to do something like that. So I think there are activities that are going like that as well. And for some of our contact survey study, the engagement is more in person. And there's a lot of like research assistants doing this kind of work because it's really in a field, because we were trying to understand contact patterns in rural China and really like telling people you have to fill out this contact survey, but some of them might not even read. Like, I think the literacy rate is already pretty slow, but there are still people like this. So what they're doing, they have to like really call them every week or every day, just like, oh, what did you do today? Who did you meet today? That kind of thing. So I think as a grand scheme of things in our project, we're doing something like that, but for COVID specific, I can't really think of too much feedback channel that we have from the community. And in an ideal world where we can, I think what we can do the most is probably through this kind of feedback sessions. And then I really think we could do something like co-mix that John is leading. Do you know about that project, right?
I'm not, no, remind me.
I think it's like a contact survey in outbreak setting. So essentially people put in their information. I think there are some questions about like how valid it is, because you're gonna get a sample of people who are very tech savvy. You're not gonna get elderly. You're not gonna get low income people, because like it really kind of just like, you have a lot of time and you're not worried about anything else in your life. You would be entering that kind of thing. But I'm also a believer of some data is better than no data, maybe. So I think that's also another way that I think we can really receive some information / feedback from the community.
Okay. I think, it's really interesting. Thank you so much. It's just 1 hour. I could go on, but I'm gonna stop here. You gave me so much to think about, and you really have a super interesting take on your work, and you're very reflective. So it's
no, this is good self-reflection as well. There's like good question. You're making me think a lot of these things when like I feel like we don't really have a lot of time to
but
do that normally these days.
I might come back with more focused questions that will also lead to both what your colleagues have been saying, so to start a conversation between you even before you're actually together. But also I think there are some stuff that I would have expected to come out that didn't, that I might also ask about. But I really hope we can, when we can go back to our non-socially distanced life, it would be nice to meet in person. You're lovely to speak to, so hopefully.
I know. I completely understand. For like somebody as introverted as me these days, I'm still just like, I just want to go to a concert when like I'm just standing next to everybody. You know? All right. Thank you so much. Let me know if you want more information from me. Okay.
Thank you. Oh, if you can just send me the consent form and the link to this web app that you mentioned.
Oh yeah, sure. All right. All right. Thank you.
Take care.
Bye.